So we do have a couple of group agreements that we have for these sessions. We ask that you please keep your microphone muted and that you allow our facilitators to have the space to go over their content. If you have any questions as we're going through our session today, we ask that you refrain from putting your questions into the chat. There's over 130 people in this room, so the chat will move very quickly. So we ask that you please drop your questions in the Q&A box, and I will show you in a moment where that is. When we do have opportunities for Q&A, open Q&A, please use the hand raised icon so that we can keep it orderly. And anytime anyone else is talking in a group setting, that we refrain from interrupting and letting people finish their thoughts and their questions. And if there's any other questions that cannot be addressed in this session, we will ensure that they are taken care of in our follow-up communications. Next slide. So how do you find the Q&A? If you look at your Zoom toolbar, you should see a Q&A icon. If you do not see it, there is a three dots more section of your toolbar where you can open up and find the Q&A to submit questions. And we just have a couple gentle reminders for today. The care delivery contact directory has been updated as of July 10th. So you can find some more contacts that have been added. And it's a helpful resource to find the care delivery contacts at all of our organizations or most of our organizations within the network. And then lastly, we have our upcoming mandatory All Navigator meeting on Tuesday, July 21st at 10 a.m. And just as a reminder, all Q&A and questions will take place during our 7:22 office hours. So this session that you're in now, that's where we'll be taking questions for all of the that have come up during the All Navigator meeting. And someone from the team will paste the registration in the chat in case you haven't registered yet. Next slide. And then we do have some upcoming supplemental training and technical assistance offerings that we would like to uplift. As always, we have a monthly calendar that has all of our enhanced care partner trainers and supplemental training partners offerings. And you can always scan the QR code to get access to all of those sessions. But I just wanted to uplift three that are upcoming and I feel are really interesting and important. We have our Decipher SmartRise VBP or Value-Based Payments 102 session tomorrow at 12:30 p.m. And that is the second of a series of 3 trainings on value-based payments by Decipher SmartRise. On July 21st at 1 p.m., EngageWell will be hosting their nutrition TA. And in order to be able to attend that TA, you have to have taken the EngageWell and food and nutrition training. So if you haven't done that, we please ask that you take that training first. They offer it really regularly, but if you did take it at the end of June, this is the session to bring all your questions. And then lastly, the Health and Housing Consortium is doing a training session on supporting tenants in scattered site housing, understanding what it's like to provide care management to those who live in those areas and in those sites. And it will be really useful if you've encountered that and didn't quite know how to navigate that situation. So that's on July 28th at 12 p.m. And I'll make sure to paste all of these offerings in the chat in a moment. But now I'm going to pass it over to Samantha Mercado, who will be our facilitator for the rest of the session. Thank you.
Thanks, Candice. Hi, everybody. My name's Samantha. I'm a manager on the coordination center team, and we are the team that's responsible for the housing hub. So today is going to be part 2 of the housing agenda that was started at the last office hours. We're going to go through sending and accepting referrals for housing, housing service timelines, housing service availability in the network, and then also just a broader scope of members' housing journey. So starting off with some reminders for sending and accepting referrals. So we essentially have, from a housing perspective, three different buckets of providers. We have organizations that do not provide housing. We have organizations that provide housing and are open to accepting referrals from the network. And then we have organizations who accept housing, organizations that provide housing services, but only to members that they serve directly. And so, for providers that do not have housing services within the organization that you're working for, you're going to send all of your housing referrals to Whole U NYC PHS. This means that you are completing the screening or the eligibility assessment with the member. At the end of the eligibility assessment, if you're seeing that they're eligible to receive housing services, this can include anything from rent to utilities, community transition supports. It includes home and safety modifications, housing remediation, and pre-tenancy and tenancy sustaining services. You are sending all of those members over to Whole U NYC PHS specifically for housing transition and case management. So this would be when you're looking for sending referrals for the member, the service type is housing case management. And then this is the program in that first bullet, housing transition and case management. When you're sending the referral, please include a description of the member's situation, include information like if it's an urgent referral, and specifically what is their housing needs without including any PHI. You're sending it for 2 units, and again, Whole U NYC PHS is the only organization that's going to accept those referrals. If you are sending directly to a housing hub provider, so directly to any other organization that you may see with that case open, they will reject your referral, and it'll end up being a delayed process for the member. Housing hub providers are only accepting referrals from Public Health Solutions. So after you send the referral to us, we are taking the time to make sure that the member is in fact eligible. There's a few kind of tricks with the eligibility assessment, so we want to make sure that that's all addressed. We're also taking time to collect documents on behalf of these housing providers to shorten their queue for when they're able to work with members. And so that's all the work that we're doing on the back end. We then send them over to a housing provider that corresponds with whatever the member needs. So sometimes we send to one provider that can cover to all their needs. Sometimes they'll be sent to multiple providers just to make sure that all the housing services that they're eligible for, they can receive. This is essentially like our triaging supports. And again, please do not send to a housing provider directly. Even if you yourself provide housing services, please still send it to PHS. If you are an internal housing provider, meaning that you offer housing services, but only to the population that you serve directly, we ask that you turn off all programs related to housing. You do not need to have those programs turned on in order to open cases and to bill for the members that you're already serving. And you do not need to send members to PHS if you're going to be the one providing their housing service. Next, service timeline. We've gotten a lot of questions recently coming in around what is the timeline for services. It is variable, but I've tried to break it out here as much as possible so that you could really understand and help guide your members. So first and foremost, once you send the referral over to PHS, we are accepting referrals at this time within 1 week for that evaluation and triage that I mentioned. And we are able to send out referrals to the provider based on the following points. First off, we have outreach attempts. We will attempt to reach out to members 3 times within 5 days after we've accepted their referral. These attempts are often sent with a voicemail if we have it, and even after these attempts are up, if the member calls back, we will pick up, but this is the maximum amount of times that we can reach out in order to continue moving through the queue that we have. The time that we can spend with the member before sending them out to a provider will also depend on how accurate the original screening and eligibility assessment were. If we only have to review the screening and eligibility assessment and confirm it with the member, that's going to be a much shorter time frame than if we have to sit down, redo the screening or redo the eligibility assessment, or collect additional provider attestations, which does need to be collected, as we've reviewed in the All Navigator meeting, if the member's trying to be eligible for certain remediation services, including air conditioners, dehumidifiers, and humidifiers. It's also going to depend on how fast the member returns their documents. Oftentimes, we get a lot of questions coming in asking about for an update on the member's referrals. We do leave notes in the overview tab of the member's profile. And so if you go in and the most recent note is that the member is that our team is awaiting documents, that means that the next step in order for things to move forwards is the member needs to turn in documents relevant to whatever service they are trying to receive. So this could be a lease document. This could be their utilities documents. It could be an ID or a ledger of previous payments or payments that are in arrears at this time. So it does depend on what service the members needed. The navigator with PHS will have gone through, explained what documents are needed, and also should have sent over a text to the member. So again, when members turn that in a timely manner, and if you all as navigators can give members a heads up around that, it would be helpful. Next, we have availability from providers. As you can imagine, we have significantly less housing providers than can accommodate the total of the network, and we're working on onboarding new providers every single week to try to get the amount or the capacity for housing services up within the network, especially as it seems very happily that all of our navigators are really getting good at identifying these needs in members. But availability is limited, and we do provide urgent housing situations priority. We're trying to prevent situations of eviction. We're trying to prevent members experiencing homelessness. And we're also helping members in any other type of urgent situation. So if there's like an urgent remediation need or an urgent like change that's needed to the home, we're prioritizing those members. After the referral is sent, we are meeting regularly with our housing providers to make sure that we're never sending over members that'll be sitting in their queue for a very long time. And so once it's sent, you should see, and you can view that in the referral tab for the member, you should see that that's accepted within approximately 2 weeks. So the referral that you're looking for specifically would be the referral from Whole U NYC to the housing provider. That should be accepted within 2 weeks. And providers are going to be able to serve members timely based off of, again, a member's response to calls. Members should definitely return calls from housing providers. If they miss anything, they could also reach out to our Get Info email so that we can try and reach out on their behalf. They could reach out to their housing hub navigator, so the navigator that they worked with at PHS, or of course, your organization could always uplift to us using the SCN coordination email. Documentation. So even though our team is collecting an initial round of documents for these providers, especially when members start to receive services on a monthly cadence, there may be additional documents that need to be turned in every single month. This is including like utilities, or if the organization's working with the member to find stable housing, there may be additional documents that are needed. And so a quick return of documents is going to mean a quick return in the services that can be provided. Next, we have cooperation from the landlord and the member. Our housing providers are reaching out to landlords and oftentimes need their consent or need their verification to provide services. And so this is also a potential sticking point that we have seen in the past, advising members as much as possible and as much as they can do or feel comfortable doing, letting their landlords know that these services are coming. Our team at PHS also has a document that we can provide if the member asks, or if the member states that they need something as to show it to demonstrate that they're going to be receiving this service. We can send over a one-pager that essentially says that they are in queue to receive services from the network. Then we have ongoing engagement through the member, right? We try to keep our members going for the full amount of services that they could possibly receive as much as possible. And lastly, it is based off of PHS's reimbursement schedule as well. Many of our providers can only take a certain number of members within a reimbursement schedule. So keeping in mind that it's I should say iterative. And so if we're not able to get your member connected within a particular reimbursement cycle, we will be helping to connect them within the next one. We do have some services, however, that are more readily available, or I'll say underutilized by the network. And so I wanted to give some insight into which services are readily available, can members expect to be easily connected to, and which services are a little bit more difficult to get connected to and may have a longer wait period. So when setting member expectations, having conversations with members about what they're eligible for at the end of their assessment. We have availability for specifically furniture purchase in community transition supports. Community transition supports, as many people know, it covers a very wide array of services. It covers rental assistance, utilities assistance. It covers lease negotiations and moving expenses, but particularly the purchase of furniture or cooking supplies is pretty readily available within the network. Utilities assistance is also pretty readily available. Members do have to have a rental assistance need, but we can send members over for utilities first and then to receive rental assistance later. A little note here, we have heard from the network that there are cases where the member has a rental assistance voucher. So they have a voucher for rent and they don't need rental assistance, but still need utilities assistance. In those cases, we're going to be working with the member to find a way to represent both the rental need and the utilities need. Um, and then lastly, home remediation, asthma remediation, and I'll also add to this home and safety modifications are very readily available. What is more difficult, what we have less capacity for within the network is tenancy sustaining and also pre-tenancy supports and rental assistance. So these may just have a longer queue time. We're still working with members to get them connected as soon as possible. We're still going to prioritize members who are in an urgent housing situation, but these are just a little bit less readily available and may have longer wait times. And we ask that you do discuss these options with members when you're sending over referrals and set some realistic expectations. We know that many times members are coming up as eligible for multiple different services. And so letting them know what realistically they may be able to receive support with first may help them plan better and also set their expectations. I did want to also go over what is included in home remediation, as we are seeing this as a little bit of an underutilized service. So it includes some large scale remediation like mold remediation and pest remediation. So mold remediation is going to be the removal of all mold infested surfaces and the installation of new mold resistant services. This does require the landlord to give approval, but if there's not landlord approval, we can also purchase supportive products. So mold resistant shower curtains, for instance, or mold resistant like renter friendly items that can be replaced and removed. There's also pest remediation, which works similarly. It's going to be the removal of all pests or pest damaged surfaces, and the installation of pest resistant services. We can do this. We have capacity within the network for this to be done in an invasive service, so structural changes to the home, or non-invasive as well, so through the purchase of supportive products. And just a list of additional supportive products that fall under home remediation. We have air conditioners, humidifiers, and dehumidifiers, a mini fridge for the storage of breast milk or medication, mold resistant items, short-term pest solutions, and asthma safe cleaning products. Many of these home remediation services require the additional clinical conditions question to be answered in the eligibility assessment, and it does require a provider attestation to confirm that the member has a condition that is exacerbated by mold, pest, or temperature regulation. And so please do not skip that additional clinical conditions question. And lastly, as I mentioned, I wanted to give some larger context into a housing journey of a member, some additional points to consider when having discussions and sending referrals for individuals. So the SEN housing services are designed to be a temporary reprieve for eligible members. So SEN services should be contextualized within the larger housing ecosystem of New York City. SEN services are limited to 6 months and are not reauthorizable. So even if a member is eligible for rental assistance, for utilities assistance, it's still important to not only set expectations for the time that they may have to wait to receive that assistance, but also to be realistic and advise members that this is only a temporary service and connect them to other services, possibly outside of the SCN, to help them um, with creating more long-term stable housing. Um, SEN housing services are not a conflict of interest to other housing programs that exist within New York City. And so it's entirely possible for a member to simultaneously be working on getting a housing voucher and also receiving rental assistance. The first step in connecting members to housing services is often that they have some type of livable income at the very minimum, right? So when we're talking about assisting members with their current housing situation, that's so either like through remediation or utility support, tenancy sustaining support. It's under the assumption that the member is able to maintain their housing in the long term. And so having a livable income is going to be essential for that. When we're also discussing the support services that are designed to get members into stable housing, so community transition supports, pre-tenancy, one of the first requirements is also going to be that they have a livable income, even with the support of our wonderful housing providers who are really experienced in this work. We still often face barriers where a landlord is not going to agree to a new housing situation if the member does not have an income that can sustain the uh, payments after the 6 months is up. Um, and again, receiving housing vouchers or completing applications for housing vouchers can be another way to make up for an unstable or low income. Number two, participation in housing searches. So we ask that members take members without stable housing take an active participation in looking for housing and hotel searches. Again, our housing organizations are doing as much as possible, but letting members know that this is going to be a participatory process and also oftentimes like a long-term process is really going to set them up for success. Connecting care managers. So members may be able to work with multiple agencies or care managers, and where possible, members should connect their care teams to inform them about the SCN. We often or sometimes get emails from lawyers, emails from other care coordinators that are outside of the SCN, and it helps if everybody's aware and has awareness of what potential services the member could be receiving. And then lastly, having conversations with members again about planning for the future. So even though we are going to be connecting them to these services, having discussions that they are short-term and discussing with the member what could get them into a place where they're able to plan for their finances and their housing situation moving forwards.